Good afternoon, good morning, or good night, depending on which part of the world you are viewing us today. I welcome you to our YouTube channel, the Lupus Society of Trinidad and Tobago, as we bring to you yet another interesting topic for consideration, both to our lupus patients and to those who are living with someone who has lupus. The title: Vaccinations and Lupus. At this time, I invite our president of the Lupus Society of Trinidad and Tobago, Mr. Clifford Balgobin, to say a few words.
Thank you very much, Judith. That was well done. Good morning, good afternoon, and good night, wherever you are on this globe called Earth. We are here for another exciting, informative session. And I tell you, this person is from our very own medical profession. And of course, you'll hear more from her, from our patron doctor, Dr. Sweet. In the meantime, this is a very important time, and we ask him to please share, please subscribe, because the more information you have, the better we can make intelligent decisions. Okay, so on behalf of the Lupus Society and Trinidad and Tobago, we are happy that you are here, and we know people will look at this program on their comfortable time, in their comfortable space. So before we take our patron doctor, Dr. Sweet, we shall have a short video presentation.
Out. I've had open sores. I've been blinded.
Kidney failure, 4 grand mal seizures, a stroke, lost the inability to walk.
I had avascular necrosis diagnosed in my left hip last May and underwent a total hip replacement on my 23rd birthday.
I went to stage 4 kidney failure and I had to learn how to walk all over again.
I've lost my hair, I've been on post steroids, the chemo.
Lupus is an invisible beast.
Lupus is an attack against my own body.
Every pain that you can possibly feel all at once.
Lupus, in a word, is frustrating.
It's like the weather, it's unpredictable. You never know when you're gonna have a flare up.
I don't know what the future holds for me with lupus. I don't know what it's going to attack next.
It does affect your organs. It affects your finances. It affects your body.
I lost my career. I lost my marriage.
I went into the ER again and didn't get to leave until 86 days later.
People need to know that it's here, it's real, people have it, people you know have it.
We're surviving with this disease, and I feel like we're conquering it as well, and we just don't have enough people that are speaking out there about it.
I have hope that someone's going to see this and know that they're not alone.
And I just know that there are better days ahead.
There is hope. We just have to get involved. I haven't given up.
Good afternoon, everyone. Welcome to another session of education for lupus patients and their families and their caregivers and just about anybody who's interested in the topic. This afternoon, we have Dr. Lesley-Ann Roper, who is a primary care physician too in our own Ministry of Health. The great thing about Dr. Roper is that not only is she versed in managing conditions that you and I will suffer from day to day, she's a general practitioner, but she also has a qualification in dermatology. So she is very, very knowledgeable about lupus and the manifestations of lupus. But she's going to talk to us today about vaccinations in relation to lupus patients. Vaccinations, I think, especially in adults, tend to be a bit neglected. We all know that the kids must get their series of vaccinations, but often they're neglected in adults. So I hope that you will listen and take away some important points and go and have your vaccinations and perhaps encourage somebody else to do so as well. So, Dr. Roper, welcome.
So I'm going to try to share my screen now. And you all can tell me if you're seeing it.
Dr. Roper, not as yet. We've seen a blank screen.
Blank screen. Okay, let's try again.
Thank you very much, Dr. Sweet, for introducing her. Try again sharing the screen. I'll be your moderator for today. Okay.
And are we seeing the screen now?
Yes, we're seeing the screen.
Okay.
Excellent.
And the whole screen?
I can put it on the whole screen like this. We're still seeing your slides on the left, but you can go right ahead.
All right. So we're going to look at the importance of vaccinations to the lupus patient. So I'm going to do a brief overview about lupus, and we're going to say why vaccination matters. We'll look a little bit about how the vaccines work and some of the challenges in vaccinating lupus patients in particular. We have to look at the timing and safety of vaccinations. And then we're going to go through the key vaccines that you may need as a lupus patient, some of the possible adverse effects or side effects, and where you can get these vaccines, and the role of our healthcare providers, expectations, and then we're just going to summarize. So systemic lupus erythematosus, so SLE for short, is a mouthful. So lupus is a chronic autoimmune condition where the immune system attacks healthy tissue. So as you know, some of you may know, the common symptoms are fatigue, joint pain, rashes, and eventually you do have organ involvement. So a lot of times patients require immunosuppressive therapies, so corticosteroids, then you have the disease-modifying agents like methotrexate, azathioprine, mycophenolate, and then more recently we have biologics as well. So why does vaccination matter? So lupus patients have higher susceptibility to infections. And this is for a number of reasons. First of all, lupus is an autoimmune disease, so there's immune dysregulation, meaning your immune system may not be working as well as it should. Then many times you are on immunosuppressive medications, steroids, methotrexate, all these drugs that help to suppress the disease activity, but they also reduce your normal immunity. And then lupus patients may also have numerous comorbidities, such as diabetes, hypertension, which do also cause a reduction in our immunity. So some of the common infections that a lupus patient may get is pneumonia, shingles, the common flu, and you have more, as we learned from the COVID-19 pandemic, there are more severe outcomes with COVID-19. In fact, a study in Holland looked at the effects of pneumonia, and a lupus patient was 13 times more susceptible to pneumonia than the general public. So this highlights the importance of the vaccination process. And we want to prevent these infections through vaccination. So vaccination reduces the risk of serious infection. It reduces the risk of hospitalization, of emergency room visits to the lupus patients. So how does a vaccine work? We always say about vaccines, and as Dr. Sweet mentioned, you think about
Okay, it seems as though she has a little technical issue there, but we try to resolve it. Please hold on. Okay, we're trying to get on to the doctor. So give us one more minute again. I'll put some music on. Thank you very much. Yes, we are taking comments and questions right after the presentation. So please have your comments and questions ready. Thank you.
During these hard times, music can be a wonderful outlet for your emotions, and so I'm very excited to share this performance with you guys today. Here is Rise Up by Andra Day. You're broken down and tired of living life on a merry-go-round. you can't find the fighter, but I see it in you, so we're gonna walk it out. Move mountains, we're gonna walk it out and move mountains. And I'll rise up, I'll rise like the day, I'll rise up, I'll rise unafraid, I'll rise up, and I'll do it 1,000 times again. And I'll rise up, I like the waves, I'll rise up, in spite of the ache, I'll rise up, and I'll do it 1,000 times again. For you, for you, for you, for you. When the silence isn't quiet and it feels like it's getting hard to breathe, and I know you feel like dying, but I promise we'll bring the world to its feet. Move mountains, bring it to its feet, and move mountains. And I'll rise up, I'll rise like the day, I'll rise up, I'll rise unafraid, I'll rise up, and I'll do it 1,000 times again. For you, for you, for you, for you. All we need is hope, and for that we have each other, and for that we have each other. And we will rise, we will rise, we will rise. Oh, we'll rise up, rise like the waves. We'll rise up in spite of the ache. I will rise 1,000 times again. And we'll rise up, high like the waves. We'll rise up in spite of the ache, and we'll do it 1,000 times again. For you, for you, for you, for you.
All right, that was. I think some of you all will know that celebrity, young lady from I think American Idol or America Got Talent. No, she's all grown up. Nevertheless, we thank her for that wonderful song. We like to bring back Dr. Roper. You know how technology works, but we work with it. So we bring back Dr. Roper back on. And as I told you guys, we will take your comments and questions right after. So record your comments and you can write it in the YouTube channel. We'll get it inside our digital studio. Dr. Roper, welcome back.
All right, thank you. So we're going to look at how vaccines work. So a vaccine introduces a weak or an inactive form of the disease into your body. Your body will then react by stimulating the immune system to produce antibodies. And then when you encounter this disease again, the antibodies remember the disease and then they can defend against it. So what are some of the challenges that lupus patients face? So, as the video showed, there's a fear of vaccine-induced flare-ups. And then you're also concerned about vaccine safety. You also worry about when is the best time to vaccinate. Should I do it now? Should I do it later? And which vaccine is safe for me? So let's look at live versus inactivated vaccines. So vaccines can be live. So some of these are like the mumps, measles, rubella. The chickenpox vaccine is a live vaccine. Yellow fever is another live one. And the oral polio vaccine is also a live vaccine. So caution is advised here. And generally, we tell lupus patients to avoid live vaccines because administration of a live vaccine could induce the disease itself. So inactivated vaccines, so these are milder forms of the disease, they are safe for most lupus patients. So some of these are the influenza, the COVID-19, hepatitis B, and pneumococcal vaccines. In terms of the timing, so during periods of remission, when the immune function is more stable, we think is the best time to be vaccinated. You should avoid being vaccinated during an active flare or if you're on high-dose immunosuppressive therapy. And also, if you're about to change your immunosuppressive therapy or increase it, you should be vaccinated for up to 4 weeks before that change in the treatment. So the key vaccines for a lupus patient: influenza or the flu vaccine. So an annual flu shot is recommended. So these are inactivated vaccines. So the Ministry of Health just put out the notice that the flu vaccine is available for 2024 at all health centers. The pneumococcal vaccine is another one that is a must for lupus patients because a study in Holland showed that the lupus patient is 13 times more likely to be infected and to be severely infected and become very sick with pneumonia than the average person. So we have 2 available pneumococcal vaccines, one with 13 subvalent particles. So it's called the Pneumovax 13. And also there's a pneumococcal 23. So the 23, you have to take a booster every 5 years, and the Pneumovax 13 is just 1 dose. These are both available at your local health centers. The COVID-19 vaccine, so COVID taught us a lot of lessons. One unfortunate lesson is that lupus patients were quite likely to have severe disease and
Well, we do apologize for this technical glitch we have. Nevertheless, while we wait on doctor to present her very important vaccinations and lupus, because many patients of the Lupus Society, the question, should we take the vaccine? Should we not take the vaccine? And other vaccines in particular. However, while we wait on Dr. Roper, we have our Judith, who will share just a short experience about what it is. What is the journey like? What is the journey like on this road of lupus. So let me bring the effervescent Judith McCloy James. Welcome, Judith.
Thank you very much. I'd just like to share with our viewing and listening public that, lupus is a very unstable disease. One day you can be up and strong, and the very next day you can be down. And sometimes it can be very, very frustrating to know that you have a career that you cannot pursue all the time, or you have some goals that you may not be able to activate constantly or consistently. All right. For me, my experience has been I have had lupus, been diagnosed with lupus for quite some time, over 2 decades. And I have had to make some very life changing choices. I had to reduce my workload. I had to change my diet. I had to seriously work rest into my day because my body was rebelling tremendously. And it is important for us as lupus patients to know our bodies. We are not doctors, but we do know our bodies, and we know when a pain is unbearable. We know when a pain is too much to bear, because we are constantly, in some cases, in pain. And as Dr. Roper rightly says, sometimes lupus is always complicated by other diseases. For me, my complication is fibromyalgia. Those of you who are familiar with fibromyalgia, it's a constant pain in specific areas on your body, So in addition to the swelling of the joints, the feet and the hands and the rash and stuff, there's a constant pain that is on your system where you are not sure how to address. Someone touches you, you're in pain. You wear clothes, sometimes it's in pain, and it is the complication that complicates everything else. So it's very, very important for us as lupus patients to be aware of our situation, know what works. For me, changing my diet was a really, really big helper, because I was on a lot of medication, and some of the medications were making me extremely bloated, bigger, and stuff like that. So again, you have to work with your nutritionalist, because your doctors are not working in isolation. They are working in total total development of you, the lupus patients. So it's important to work with your doctor. I see the doctor is back. So next break, we will continue more on this conversation. Thank you for listening, and thank you for being here, everyone.
Right, so the current recommendations for the key vaccines for lupus patients include the flu vaccine. So annual flu shots are recommended, and right now in Trinidad, we have available the 2024 flu vaccine at all health centers. The pneumococcal vaccine protects against both pneumonia and meningitis, and we have two available, the pneumococcal 13 as well as the 23. So the 23 is recommended that you get a booster every 5 years, and the 13 is just one dose. Both are available in our health centers. The COVID-19 vaccine, we learned one of the many lessons, a terrible one from COVID, is that lupus patients were particularly susceptible to the negative effects of the COVID-19 vaccine. So we encourage lupus patients to get the COVID-19 vaccine if they have not done so already. Shingles. Shingles is another common infection in lupus patients. The herpes zoster vaccine, we have a non-live vaccine now available in Trinidad called Shingrich. It is recommended to prevent shingles in those 50 years and above, and it's given in 2 doses, 2 to 6 months apart. The hepatitis B vaccine is also recommended for patients who are at risk, especially those receiving immunosuppression. And the tetanus toxoid, just as in the general population, should be given every 10 years. HPV. HPV is an important virus. It is known to cause cervical cancer in women. So in Trinidad and Tobago, we recommend 3 doses for immunocompromised patients. Sorry, I think I sat on. So in patients more than 9 years, you have 3 doses. So the second dose is given 2 months after the initial dose, and the third dose 6 months after the initial dose. So some of the possible adverse reactions you may see. So just local reactions, so redness, swelling, or pain at the injection site. And then sometimes you have systemic effects as well, where you feel a little bit achy, you get a mild fever or chill or headache, and you feel a little lethargic. But these usually just last a day or 2. In very rare cases, you may have an allergic reaction. And lupus flares are
Hi, doctor, you're back on. Don't worry, we have you.
I feel like I'm hanging on by a thread.
You're doing well so far.
You're hearing me?
Yes, we're hearing you. You can go right ahead. Thank you. Yes, Dr. Roper, you're live. You can go right ahead.
Okay, I'll just continue talking because I'm having a lot of technical difficulties. So the key point is that a lot of these vaccines are actually available at your local health center. So we do have available the pneumococcal vaccines, and there are 2 of them. There is one that is only 1 dose, that's the Prevnar 13. So you can go to your local health center and request this. We also have the Pneumovax 23 that is available as well, and that one you have to get boosters every 5 years. The HPV vaccine. Now, HPV is a virus that causes cervical cancer. So all lupus patients, it is recommended that you have this vaccine. So for immunocompromised patients, the ministry has put out a mandate that you are given 3 doses rather than just 2. So the doses are at 2 months from the initial dose and then 6 months from the initial dose. So tetanus vaccines should also be given to the lupus patient, and they are given every 10 years as with the general population. The COVID-19 vaccine is an important one for you as well. We know from COVID that a lot of lupus patients did not do well at all with the COVID-19 infection. So we recommend that you get that as well. Right now, there is no COVID-19 vaccine available in Trinidad. Maybe in the future, it will be added on to the regular flu vaccine since COVID is now endemic, meaning it's all over the world and the virus is changing. So take-home messages is that you need to have an active role in your care. So as doctors, as healthcare providers, we sometimes forget to push the recommendation for vaccination. But it is in your interest to say, well, doctor, what about this? Should I get these vaccines? I read that these are recommended. Where can I get them? How can I get them? What is the best timing in which to have this done? So I'm telling you that most of them are available at your local health center. The only one that is not is the Shingrix, which is the new vaccine for shingles or herpes zoster. That one is available privately. You could get it at private physicians. The rest of them, they are all available, and you are welcome at your local health center to come in at any time, and you will be attended to. So I thank you very much.
Thank you very much, Dr. Roper. Very concise. I mean, despite the little technical
Yes,
glitches,
a lot of
the
technical.
information was important. I know you're taking your busy time away from family as well to join us, right? But nevertheless, I know the lookers or the folks who are looking at our channel later on during the day, during the night, whenever time is good for them,
Yeah,
the information is vital.
great.
Let me see if there's any questions or comments from anyone. I know they're saying good afternoon, good afternoon, good afternoon. Some folks. But you mentioned, Dr. Roper,
Yes,
that the vaccine for lupus, not for lupus, the vaccine for COVID was A-OK.
yes.
All right, all right. So that
It
should,
is recommended for
yes.
patients with lupus,
Okay, great.
right?
Any particular one or brand or?
So right now, because we have no vaccine, no COVID vaccine in Trinidad at this moment,
Yes.
right? So as with all vaccines for lupus patients, we recommend the inactive form. So all the COVID, once it's an inactive form,
Okay, so you hear that, lupus patients, that Dr. Rupert told us that it is safe,
it is
right?
safe. Once it's inactive, yes.
Okay, great. Other things about vaccines. Um, so let's say one of our lupus members get, like, you know, something rusty stuck them.
Yes,
Tetanus.
yes.
Tetanus is safe, right?
Tetanus is safe. It is not a live vaccine. It's a
Okay.
toxoid. So it is safe for lupus patients. And
Okay.
it's recommended to get a routine tetanus vaccine every 10 years, same as the general population.
Okay. Okay. I'm asking this on behalf of the lupus patients because, as simple it may sound,
Yes, no, these are very important questions.
yeah, yeah. So, what would you consider as live vaccines?
Live vaccines are varicella, chickenpox is a live vaccine.
Okay.
Oral polio, which infants get, that is a live vaccine.
Okay.
The MMR, mumps, measles, rubella, is another live vaccine. So
So
those
these,
lupus patients should stay away from.
stay away from. So how we have this mpox happening? What would you say?
Well, we don't have a vaccine available for that in Trinidad as yet. So It would just be the normal precaution
Yes.
in terms of not being around somebody with, but right now we have no cases, thank God, in Trinidad.
Okay. Okay, we have a question coming up here. Let me put it on the screen. It says, you mentioned that with one vaccination, a person with lupus should have 3 shots, as to 2 for other persons. What accounts for that?
Right. So that was with one particular vaccine. That's the HPV vaccine. That's the one that causes cervical cancer in women.
HPV. Okay.
Yes, HPV. So because of the immunocompromised state of the lupus patient, so the recommendation is for all immunocompromised patients to get 3 doses rather than 2 as in the general population, just because, as I mentioned before, your immunity as a lupus patient may not be the same as somebody without lupus or somebody who is not immunocompromised. So in order to boost or to have that effect, to make sure that the vaccine is efficacious, we recommend 3 doses rather than 2. So it's just like an extra boost for you.
Okay. And I think a lot of the lupus patients will want to ask this question. When you say 3, do you mean 3 immediate, one after the other, or something?
No. So you have the first dose, then the second dose is 2 months after the first, and the
Okay.
third dose is 6 months after the first dose.
Okay. So we're looking at 6 and 3, 9 months.
6 and 2, 8. Yeah.
Oh, yeah, 6 and 2. Sorry about my maths there. Yeah, 6 and 2.
6 and 2,
All
8.
right.
Yes.
Yeah, I know it's a Sunday evening, so yeah, 6 and 2. Oh, wow. Dr. Sweet, do you have any questions you'd like to ask or get something clarified from Dr. Roper for lupus patients?
Well, not to ask a question, but simply to reinforce what she has said about the need for lupus patients to be immunized. I think that lupus patients may say, oh gosh, but I've taken so many things already, so many medications, and I think I really want to go and take a vaccine. But they don't realize that the reason for having a vaccination is to, stop them from being ill with other things that will complicate the course of their lupus illness.
Yes.
So it really is important that they should get vaccinated.
Okay.
But I
Great.
have a question about yellow fever, for example. Yellow fever is a live vaccine?
Yes, yellow fever is live.
Is live. So some countries require you to have a yellow fever vaccine. Let's suppose patients is traveling to Suriname, for example. They're told that they must have the yellow fever vaccine. How can they get around this?
Okay, so yellow fever, 1 dose of yellow fever is enough for your lifetime. So if you have to travel to a country where they're requesting a yellow fever vaccine, you can come to your county medical office of health. And if you have an immunization card, you can present it to us, and we would do a letter stating that you do not need a subsequent dose. Even if you cannot find your card, still come, because we know that all people over 50 years would have received the vaccine in the past. So you do not need to get the vaccine again. So don't feel forced to do that.
Right. So they can actually get a note that says they don't need it.
Exactly. And you get that from your local county medical office of health.
Right. Yeah. Okay, good.
Dr. Sweet, that was an excellent question. I think very relevant. Traveling around South America and some parts of the Caribbean, they do ask for that yellow fever vaccine. I remember going to Suriname and I had to get that, even Guyana. So I'm very happy that the lupus patients can get a note, right? We have one more question. One more questions here. Judith asked, do any vaccines cause serious side effects for lupus patients as their immune systems do not function as other people?
Yeah, so that's another good question. So yes, so that's why we avoid the live vaccines, like the same yellow fever, oral polio. and the chickenpox vaccine. So these can actually, if somebody is immunosuppressed, as in lupus, and then on immunosuppressants on top of that, you can actually get the disease. So you can get yellow fever from the yellow fever vaccine then, because it is a live vaccine. So that's why we recommend the inactivated versions of the vaccines. So the influenza, COVID, HPV, all these other vaccines are inactivated vaccines and therefore are safe in lupus patients. So there are only certain vaccines, the live vaccines, that are not safe for you as a lupus patient. But there's a long list of vaccines that are safe for lupus patients.
Dr. Roper, I thank you so much for, sharing your time, sharing that very vital medical professional advice. And it is very pertinent because, lupus patients listening to this, even the loved ones listening to this will understand that, hey, they can't take just any vaccine, especially the live ones. And we are very happy to know that we can get our lupus patients can get a note, so when they're traveling it can help. I think we need to do some more work on that with the Ministry of Health.
So
Okay.
yes, I think we both, yes. So awareness is key. So programs
Yes.
like this are so important.
Yes.
And even our doctors need to be aware of what you can and cannot take, and also remember to recommend vaccinations, because sometimes we forget to patients to recommend the vaccinations because it is so important.
Excellent. Dr. Roper, again, we just want to say thank you so much for your time. Thank you so much for sharing this very vital information. And I know our lookers, our online viewers, I should say, not lookers, viewers, really enjoy your presentation. Okay. We will meet at another time. To really appreciate what you did for us. Do have a pleasant evening. I see you're busy with some kids there too. So
Thank
do have
you.
a pleasant evening. Okay.
Yes.
And our online viewers, remember you can redo this video, look at it over and over again, take your notes down, and loved ones do the same thing so that we can help save our lupus patients. Share the information and let's continue to support each other. Please, everyone, have a pleasant evening, morning, and good night. Have a good day, everyone.
Thank you.